Happy holidays, Sonoma County, Napa County, and
What?
Maui County. Maui.
Sorry.
Aloha.
What was I supposed to say?
I guess we didn't rehearse that. Happy holidays,
No.
everybody. I'm Dr. Tom. I'm Ask the Expert, KSRO, and I have, once again, our right-hand person. We have Karina, who's our medical assistant, as our surgical assistant and surgical liaison. Hi, Karina.
Hi everyone.
Hi. How was your Thanksgiving?
It was great. How was yours?
Mine was great.
Yeah.
Full of family, and we had a few stray dogs
food.
spending time
Yeah.
with us and sharing, breaking bread together. It was great. Hopefully everybody here had a great Thanksgiving. Hey, so Karina, we're just coming out of Thanksgiving,
Yes.
and now this is our busy crunch time, right? And this
Yes.
is when everyone's getting ready for the holidays.
Yes.
And the phones have been ringing and people trying to get in. All right, so if you're interested, give us a call so you can get in and see us as soon as
Absolutely.
you can. Karina, from a woman's point of view, and we can talk, I'll talk from the guy's point of view. Notice how I lowered my voice when I said that to you. Okay. When we talk about getting ready for the holidays, what are the treatments that you like or what you would recommend to a lot of your friends, your girlfriends, your mother, their friends, and so forth? What would you recommend?
Right. Well, there's a few treatments that we
Okay.
can always get started. Of course, it's always the stress of the holidays and the fun and all of that. So these are all things that can be done pretty quickly.
So you want no downtime?
No downtime.
No downtime.
You can
Quick.
go and
Okay.
keep doing your shopping and stuff. So yeah, there's a few treatments.
Okay, so give me what's your first treatment that you would recommend?
We all want to look glowy during the holidays.
Okay,
right?
we want to
It's
be glowy.
cold, or we want to look our best. So Hydrafacials, that's definitely one of my favorites.
Hydrafacials. Okay, so Hydrafacials is your number one pick. It's an interesting pick. So you're kind of looking at the skin, and you said that people want to be glowy, okay, or dewy, or whatever the correct terminology is nowadays. They want to look good. Okay, so they want to have fresh skin. They want to look healthy and vibrant and bright for the holidays. What is a Hydrafacial?
Well, a Hydrafacial is it's a exfoliation, cleansing, and for your skin.
For your skin. Okay, so Denora, who is our wonderful esthetician,
Yes.
and she's wonderful. She's great. She does my treatments. I've had Hydrafacials with her. I've actually had a VIPO with her,
Yes.
and I love the results. And so a Hydrafacial, what I like to call it, it's a little bit like an industrial carpet cleaner.
Yes.
So what Denora will do, our medical esthetician, she'll take a wand, which is actually basically squirting out a serum, okay, with some exfoliators in it and nutritional aspects to it, but basically trying to squirt this fluid and hydrate your skin, and then it's also suctioning out debris. And Karina, so I oftentimes refer to this, or an analogy would be, is you're getting ready for the holidays,
Right.
and you're looking at your carpet and it looks kind of dull, so you say, I'm going to save some money, and I'm going to go down to the local hardware store, and I'm going to get my own, carpet cleaner, and you go and you use your carpet cleaner and you do it, and it looks pretty good, right? Yeah, it looks pretty good. But then, say, I want it to look really good.
Right.
So you call the commercial carpet cleaner. They come in with all their commercial equipment and all, and all of a sudden the carpet looks new, right? I mean, we do that. We have pets, so we have to get our carpets cleaned frequently. And my gosh, I mean, it feels moist, right? Just like a Hydrafacial, it hydrates your carpet, and that it's super clean. It's the cleanest it's ever been, right? With this commercial cleaning, and that's what a Hydrafacial does. So a Hydrafacial is, consider it like a commercial carpet cleaner. I know that doesn't sound very sexy there for the holidays, but boy, we could all use some good commercial carpet cleaning of our face.
Yeah, another thing that I want to mention is that it's completely customizable. So if you're drier during the holidays, Denora can curate a special serum that is hydrating for your skin, right? If you tend to have breakout because you're being stressed and you're running around, she has another serum. So there's different serums. There's a brightening serum, so she can definitely customize it to your skin and to your needs, and make it better for you.
That's great. Thank you so much. I'm glad we have you on this show. That's really actually a great point that I just totally skipped over. So again, having it being customized to your skin type. Denora is awesome. She listens so well. Unlike Karina, she actually listens to me at least. But Denora listens to you and can customize the appropriate amount of what might be in the serum with the Hydrafacial. So Hydrafacials, I absolutely agree with you 100%. It's quick. It takes about an hour to do, right? An hour, and you walk on and your skin is glowing. and it's like that for days. And what I like about that, especially for women who tend to wear makeup, is that they need less makeup.
Right.
And using less makeup actually is, for a lot of these women, is liberating and actually makes them look younger. You know, because a lot of times one of the giveaways of women have told me of getting older is that they have to put more and more makeup on, and that's kind of a sign of the skin that they have to hide imperfections. And so the Hydrafacial is wonderful.
And it is a little bit of a downtime for you. I mean, it's nice in there. She has a nice glowy light, some spa music.
Positive
you can
downtime.
lay down.
Okay.
You know, so
Right.
you know, it is quick, but it's a time for you.
Right. So self-care. I like that.
Self-care
Okay.
during the crazy times.
Awesome. Okay. So Denora is our medical aesthetician for Hydrafacial. What's your number 2 treatment that you like?
It can be tagged along to Hydrafacial. So dermaplaning.
Dermaplaning. What's dermaplaning?
Dermaplaning is, well, it's exfoliation of the skin, right?
Okay.
Denora will take a blade, you know, she's trained in it, and she'll get
a surgical blade.
And she'll remove, you know, can remove some of the dead skin cells, can also remove facial hair, peach fuzz. So as you're getting ready for, you know, after your Hydrafacial and you're going to get all dolled up and makeup on for your holiday party or whatever it is, you know, your makeup just, everything goes on smoother. Your skin just, it adds on to that layer of glowing and just smoother skin.
That's a really great point. So Karina is mentioning dermaplaning, which is, and Denora is excellent at that as our esthetician, using a surgical scalpel and basically sort of just taking off the finest layer, top layer of skin. And so there's a lot of debris in there, which is cleaned up by the Hydrafacial, and most women combine this, correct?
They can.
Okay.
You know, Denora will obviously say if, you know, if you have very sensitive skin or anything, but it can definitely be a combined service. Yeah.
So something that being 3/4 Chinese and 1/4 Greek, I don't have a lot of facial hair, so I don't quite understand that, but I know that women have told me that peach fuzz is very problematic for them. What's the deal with peach fuzz? Why is that hard for women?
So I think that for feel like it gives a texture to the skin, especially when you're applying makeup over.
Oh, it interferes. It's hard to put makeup on.
Alone you may not see it too much, but when you're applying makeup over the peach fuzz, it can kind of look like texture when really your skin is probably great. It's just
so
excessive,
instead of looking smooth, it makes it look rougher.
Yeah,
and
just
clumpy.
rougher. Correct. So.
Okay. All right. So dermaplaning, and so those are 2 really very affordable and no downtime, except for the personal self-care downtime for an hour. By the way, she does great hand massages, man, especially for a surgeon. You know, she did my Hydrafacial and my VIPL and got a little hand massage in there. I think she was looking for a raise. I don't know, but she, but she was, that felt really great. Okay. So we're talking about skin there. Is there anything else that you would say is a must-do before the holidays?
Yeah, well, you got to get your Botox and Dysport on board. You got to get those muscles from not moving. If you're frowning at that wish list that you're like, how am I going to find this? You got to make sure your eyes are open for all that smiling you'll be doing.
All right. So Karina's talking about Botox and Dysport. Dysport's the other Botox. We call them neuromodulators, and you mentioned about the muscles. So we have certain wrinkles on our face that are related to muscle movement. And so the ones that can be perceived as negative make you look like a Grinch, right? Instead of a happy elf is the frown.
Right.
Okay. So the 11s. And so those muscles, if we inject them with Botox or Dysport, we can soften those, and you no longer look angry or tired or overly concerned. Are there any other benefits to getting Botox or Dysport in the frown area?
Yeah, I feel like it can help with skin, just smoother skin.
Okay.
And then just over time, just make you look better.
Okay. So Karina has big eyes, and so she isn't thinking about it as much as I do with my ethnic Asian eyes, but definitely Botox in the glabellar or the frown area can help to open up the eyes. And that's really something that's really great, kind of have that more wide-eyed look. If you're on YouTube, by the way, go on YouTube. It's under Dr. Walter Tom. And if you like us, subscribe. And we put all our shows on YouTube as well. And you'll be able to see that Karina has these big eyes. And, you know, I have the eyes that I kind of keep on trying to open them up more. And so Botox is a definite must for me between my eyes. talking about the eyes and wanting bright eyes for the holidays, Karina, especially not just for me having 3/4 Asian and 1/4 Greek eyes, but for almost everybody, when we smile, we tend to crinkle our eyes on the side of our eyes. And the crinkle's okay, but what happens is also is that we squeeze down, and so it tends to make our eyes be more narrowed. Okay, I see Jeff, our producer, over there, and I see him he's kind of crinkling his eyes, and he's looking at that. I know that models somehow learn how to smile and keep their eyes open. I don't know how they do that.
I'm not quite sure. Those are, I don't know.
Yeah, they're professionals. Okay, but for us lay people, when we smile, my eyes kind of get really squinty, so I like to keep them open. And so Botox or Dysport injected on the side of the eyes are great. And if you're thinking about doing this right before the holidays, there is absolutely no downtime. I mean, the biggest thing is we don't want you to lay down for about 4 hours and don't go to the gym immediately afterwards. But you can go back to work. You can do all your usual living things. You can go Christmas shopping, Hanukkah shopping, whatever shopping. Okay, you can do all of those things with no downtime. And it does take couple days to kick in. So if you're thinking about doing this for the holidays, or if you have a holiday party, you want to plan it about 3+ days beforehand. So again, give us a call if that's something that you're interested in. In my opinion, I agree with you. It is a must do for the getting holiday ready aesthetically. Okay. And that goes for men and for women. And by the way, I mentioned to Karina about, what do you want to do for the ladies? And I said I'd mention that for the guys. Absolutely, a Hydrafacial would be great to cleanse the skin, having it look bright. You're going to look healthier, more youthful. You're going to look more cheery, if you will. The dermaplaning, I'm not so sure for men that's as much of an advantage as women see. But Botox and Dysport probably even more so for you guys in terms of us, because we tend to frown heavier and so forth, and kind of softening that and opening up our eyes. We want to go from the Grinch to the happy elf. I want to look like Will Ferrell in Elf. Okay. Have you been watching any Christmas movies yet?
Actually, the Grinch came on last night, but I was really tired, and I was like, this is actually a really cute movie, so we'll probably resume watching that with the kids.
I think Elf has sort of become I didn't watch it much when I was younger, but I think that's become my kind of favorite one. And actually, Santa Claus with Tim Allen is a great one. Where if the kids haven't watched that one, definitely, I'll come over. I'll bring the popcorn.
Okay.
So we talked about Hydrafacials, dermaplaning, Botox, Dysport, open up our eyes, not look so angry, happy for the holidays. What else can we do? And let's talk about the ladies now. What else can we do right before the holidays with minimal downtime?
Yeah, of course. Well, we can always plan on enhancing our lips. We can always, Christmas and smiling, maybe a few smooches in there. New Year's kiss.
Mistletoe.
Mistletoe. You never know.
All right. So a little bit of lip filler. And, sometimes I know people go, oh, lip filler. And I see these people and they look like fish and it looks awful. You got to go to the right place where they understand body proportions, beauty proportions, help to guide our patients. But I totally agree with you. Lip filler in the appropriate places on the lip, the appropriate amounts can really lead to a beautiful smile, makes that lipstick for women go on a lot nicer. Especially with if you're listening on the radio now, you can't see that we have our Santa hats on, but wearing your red Santa hats and a little red lipstick.
Red lipstick is all coming out. So,
that's right.
So we just had our patient who came in for.
We just did right before we headed over here who wanted lip filler. In fact, I think we're seeing a post-breast dog patient when we get back, and she wants filler as well.
She wanted to sneak that in.
She wants to sneak that in. So lip filler, I think, is actually a great way to go for women. And so for guys, they may say, well, I don't need anything for my lips. But sometimes for us guys, in terms of potential for filler, we may find that our cheeks are a little bit sunken in, eyes look a little hollowed. And a lot of times a little bit of filler in the cheeks can kind of plump them up a little bit. And again, make us look a little bit more merry, very everything and be ready for the holidays. So definitely lip filler for holiday glam. That's what I like to call holiday glam. Lip filler. And so, is there anything else that you can think about? Because I have one up my sleeve that I think is good.
Okay, well, let's hear yours.
Okay, so I was thinking about what are we going to talk about, and I was thinking about the poem "The Night Before Christmas." Okay,
Okay.
and so it starts,
Okay.
the night before Christmas and all through the
You're not
house,
going to
right?
make me recite
No,
it,
I'm not
right?
going
Okay.
to. Right, right. Now the creature was staring, right? So there came a part where, and I remember that, and I'm kind of thinking of one particular treatment that we offer, and it made me think that if we're feeling like we're looking a little bit like Santa Claus, okay, I mentioned that Santa Claus with Tim Allen was a really cute movie, but if you'll see the changes morphing in him, you see the changes on his face that he's morphing into Santa Claus. And there's a line that says that his cheeks were like roses and his nose like a cherry. Okay. I think Santa Claus has rosacea. Okay.
Okay.
So, kind of that redness, that ruddiness on the face. And so his cheeks were like roses and his nose like a cherry. So if you're somebody who suffers from that, maybe especially in the cold weather, the cheeks get more red than just a healthy glow, right? Or their nose looks red, or even for some people, they'll feel that with the rosacea, they get embarrassed or they're around people, they get flushing in the face. Sometimes they feel that people think that they're, quotes, a drinker because their nose is red, even though that's not true. Okay. I know that the British medical journal called Lancet once described rosacea as the most socially embarrassing disease. And that's probably what they were referring to. People get this redness, they get flushing, they feel very embarrassed when they're giving a talk. Let's say you're giving a talk to someone, and so somebody might think, oh, you're not very confident, or why are you flushing? Why are you red while you're speaking? Okay, those are kind of visual cues. So what I would recommend for you, if you have that and you'd like to have that be cleared up somewhat before the holidays, is that you have what we call a photofacial or a BBL, which stands for broadband light treatments. It used to be called intense pulse light, IPL. Broadband light is just sort of a better iteration, a more modern iteration of IPL. And so photofacials is where we, and that would be with our nurse Jess, okay, and she will cover up your eyes, and then she'll put a cold gel on your face, and then with a handpiece you'll feel these very light pulses of broadband light, BBL, okay, not a Brazilian butt lift.
Yes, not those cheeks.
Yeah, not those cheeks. We're talking about the cheeks and the face, okay. So you'll be getting pulse with light on your facial cheeks, and what happens is the pigment or the redness or the blood vessels absorb the light like a dark shirt on a sunny day, and they can shrink down. Sometimes we can make them go completely away, at least for a short period of time, but definitely can make that flushing be improved, less flushing, if you will, and also to kind of take away that ruddiness, or if you have those spider veins on your face. That's something that you probably want to schedule as soon as possible. And the reason is you may have a couple days where your face is a little swollen. Maybe the blood vessels may look a little bit darker. Some of the hyperpigmentation may look darker. And when you get that, it will look a little bit like dirt. And you don't want grandma coming up to you at Christmas time, licking her thumb and trying to rub it off your face, okay? It just sort of flakes off over time. But a photofacial or with our BBL, that would be great if you're feeling like Santa, where your cheeks are like roses and your nose like a cherry, okay? So if you have that, you have rosacea, I'd recommend that, okay? So we just talked about 5 different treatments that have really minimal downtime, can be done in a short period of time and get you back out into the living world. Anything else that you can think about in terms of doing a sort of getting holiday ready quickly for our patients?
Oh, I think these are all great services that will, even in the long run help you, but definitely for the holidays and the just getting ready, I think these are great.
Correct. Okay, so I would agree. So just in summary, Hydrafacials, okay, to drive hydration into the skin, a more youthful look. It exfoliates. Dermaplating for that peach fuzz, so you can have that super smooth skin. Applying makeup on, as you described, Karina, Botox and Dysport's an absolute must for the frown, for the crinkles of the eyes, the crow's feet, help to open up our eyes, looking nice and chipper, for, if you will, for the holiday parties. Lip filler for the holiday glam. You mentioned that. And the key, by the way, a little technical part of that is, so you don't want to look like a fish, is remember, and Melanie, our nurse practitioner, Mary, our lead nurse, and myself were the ones who do the lip injections, is that we want the lower lip to be about 50% bigger than the upper lip. And that actually kind of goes across most ethnicities. I think for the Caucasian and Asians, for the most part, they want the lower lip to be a little bit bigger than the upper lip. That keeps it from looking like a fish. That maybe for Latinas like yourself, Karina, maybe we don't do a lot of African Americans because their lips are pretty full. Occasionally we do, but maybe for more the Latina or the bigger lipped woman, they may come to an upper to lower lip ratio of about 1 to 1. Okay, so again, coming in, consultations are free. We take pictures, we go over them with you, and we want to do what's best for you. We want to try to achieve the look that you're looking for, but you also need our guidance to what's really reasonable, what is a reasonable expectation. So lip filler. And then again, the night before Christmas, if your cheeks are like roses and your nose like a cherry like Santa Claus, you want to do the BBL or the photofacial. Cold gel on the face. You'll work with Jess, our laser nurse specialist, skin specialist, and she can pulse the skin with the BBL, our broadband light, and that can help to diminish the redness, especially, and I think for guys, especially in the nose area. We certainly see that in women, but in guys, especially Northern Europeans, English, Irish, German, when they get that ruddy nose, it's very embarrassing for them. And so a treatment with the photofacial or BBL is very helpful. The last thing that I would add that I think is great is actually skincare products. Okay, we just were lucky enough to go to an educational event, an Abaji educational event with our local rep yesterday over at the Fountain Grove Country Club. She hosted it there, and there are some great products, and we have also our own Dr. Tom line and our Skin Better line, which even with a week or two of using these, your skin can look bright and healthy and hydrated, okay, and help to diminish fine lines, and it can make a huge difference. So I would say that products are something that you should definitely look at. And we have Denora, our medical esthetician, and Lauren, our patient coordinator, there all the time. They're always available to answer your questions, go over things, and they can give you some great insights. Even though they're young, they're pretty educated, pretty smart about all this skincare, and they can do a great job. The last thing, Karina, that I can think of, besides wishing everybody happy holidays, is going to be our show for the holiday season, is that we do have gift cards. We do have gift cards at Dr. Tom Cosmetic Surgery. So if you're kind of looking for some, stocking stuffers, just give us a call, and Lauren and Denora can set them up. But overall, I think that we want to wish everybody here a very merry everything. No matter what you celebrate or you don't celebrate, we're wishing all of you wonderful holiday season, and we are very grateful for you, for our listeners who tune into us on first Thursdays of every month here on Ask the Expert. Those of you who subscribe to us on YouTube, or just and all our patients who come and see us. I would like to think I live my life gratefully, and I am grateful to all of you. Grateful to have Karina here. Grateful, Jeff. Hey, thank you for being with us. Jeff gives us the Shaka sign. We really appreciate that. So we want to thank everybody for listening in and for supporting us throughout the year at Dr. Tom Cosmetic Surgery. So again, a very merry everything to everybody. Happy holidays. Happy holidays, everybody.